Hello and a very warm welcome to this explainer. Today we're unpacking something that's absolutely foundational for literally any medical professional. We're talking about a complete, two-part blueprint for setting up and scaling your medical practice. We're going to look really closely at both sides of the coin here. The immediate, day-to-day clinic workflows that totally dictate your patient experience, and that long-term, hard infrastructure, the hospital architecture that ultimately secures your success. So, whether you're opening your very first clinic or you're looking to scale up to a full hospital, the decisions you make right now, they're going to pay off for decades.
Okay, let's dive into this. We've got a super clear roadmap for our two-part blueprint today. First, the front door experience. Then, perfecting the consultation. Third, ethical practice growth. Fourth, reinvesting for long-term success. Fifth, hospital architecture essentials. And finally, number 6, slashing your electricity costs.
All right, let's kick things off with Section 1, the front door experience, or mastering the first impression. We're looking at the very first physical and digital interactions a patient has with your clinic.
I want to pause on this quote from our source material for a second, because it really sets the tone for the whole shebang. It says, "Patients are choosing to trust us with their care. Our practice exists because of that choice, not despite the inconvenience of serving them." I mean, wow, right? Medicine, at its core, is a service profession. Most people walking through your doors, they're in pain, or they're in deep distress. Human connection and genuine empathy, they matter just as much as your clinical excellence.
So, keeping that deep empathy in mind, let's look at the physical setup of your reception area. Many of your patients are going to be elderly or unwell, which means accessibility is an absolute must. You need level, non-slip floors throughout the space, absolutely no steps to trip over. The space should be airy, well lit with plenty of natural sunlight. You've got to provide clean, cold drinking water, a really well-maintained toilet, and comfortable seating. And critically, from an emergency readiness standpoint, a wheelchair, a stretcher, and an oxygen and emergency drug trolley literally must be on hand at all times. No compromises there.
But hey, the physical space is really only half the battle. We have to talk about the human element. There is a massive, sharp contrast between just pushing patients through a queue with brisk efficiency and treating them with true empathy and patience. For most patients today, their very first contact with you is a phone call. You absolutely must give your receptionist a written standard operating procedure, an SOP, on exactly how to speak with patients. Because listen, tone matters just as much as the information they're giving out. Your staff needs periodic retraining in mindset, not just in how to click around the scheduling software. They need to understand how to handle distressed patients with genuine, real patience.
Moving right along to Section 2, perfecting the consultation, inside the doctor's office. This is where your professionalism directly dictates the patient's trust in your diagnosis.
And listen, professionalism starts with one simple thing: availability. Doctors must commit to a minimum of 7 to 8 hours a day in the outpatient department, the OPD. This is completely 100% non-negotiable. If you're frequently unavailable during your posted hours, it just screams a lack of professionalism to your patients. Plus, it creates this sneaky second-order effect. Your staff, they're going to become noticeably less attentive when the boss isn't consistently around. Reliable availability is just part of the service, plain and simple.
Now, once you're actually inside the consultation, you need strict boundaries to protect both the patient's experience and your own professionalism. Keep the mobile phone use to an absolute bare minimum. Focus solely on the patient sitting in front of you. Please do not chat with anyone else while examining them. Always, always ensure a female staff member is present when examining female patients. Oh, and furthermore, you really must adopt digital prescription software. Not only does it make tracking patient history a breeze and save you actual time during consultations, but these systems are incredibly valuable for your financial record keeping. Financial irregularities are a huge vulnerability in clinic management, and this software locks down those vital records securely.
Okay, so you've mastered the front door and the consultation. Your clinic is humming along, running smoothly day to day. The natural next question is, how do you actually grow? Well, before we pivot into part 2 of our blueprint to answer that, if you're finding this explainer valuable so far, please take a quick second to like and subscribe to the channel. It really helps us bring more of these deep dives directly to you. All right, let's talk about scaling up.
Welcome to Part 2, Section 3, Ethical Practice Growth, Expanding Without Compromising Values. Growing a practice ethically is all about balancing getting the word out with genuine patient satisfaction.
So paid print advertisements, magazine ads, those massive hoardings, they're simply not considered ethical in medical practice. Instead, you need to lean on ethical avenues. This includes things like hosting a press conference at your inauguration to announce your services, sending formal, polite letters introducing your expertise to local doctors, proudly displaying your qualifications right there in the OPD, and hosting local continuing medical education sessions, or CMEs. And this brilliantly illustrates a key truth, actually. Hosting a CME isn't just about teaching. The real magic, the real value, lies in building genuine relationships with your fellow local doctors. For sure, this is the most sustainable growth strategy you can possibly employ.
Next up, Section 4, Reinvesting for Long-Term Success, Surviving the Growth Plateau. Because as your ethical growth strategies take root, you're inevitably going to face one of the toughest phases of practice management.
Let's walk through the natural life cycle of a medical practice. In those early years, the patient flow builds up very, very slowly. It really tests your patience. But if patients are genuinely happy with your care, that growth eventually becomes exponential. It shoots up. However, every single practice eventually hits stage 3, the plateau. Many practices, unfortunately, just decline or stagnate right here. The only way to push through that plateau and keep your practice thriving is stage 4, deliberate reinvestment.
So you might be wondering, how much should you actually reinvest? Well, the source material gives us an absolutely crucial benchmark. You should be allocating roughly 10% of your annual profit right back into upgrading the hospital facilities and equipment. This is the secret sauce that keeps you competitive.
Let's break down exactly where that 10% should be going across 3 main pillars. First, upgrading your facilities, like your operation theater equipment. A surgeon investing in their OT creates a much safer environment for patients and vastly improves their own daily working efficiency. Second, reinvest in your personal knowledge. Medical science moves incredibly fast, right? Use point-of-care references like UpToDate and go to those conferences. A decade of complacency will literally make you clinically outdated. Third, reinvest in relationships and joint ventures. Bringing in new collaborations is very often exactly what sustains a practice well past its initial growth phase.
All right, let's look at the actual building now. Section 5, Hospital Architecture Essentials. Getting the hard infrastructure right. As your practice scales up, your physical building design should be NABH compliant. That's meeting standards set by the National Accreditation Board for Hospitals right from the very start. I honestly cannot stress this enough. Retrofitting a building for compliance later down the road is way more expensive than just planning for it up front.
Let's slow down our pacing here for just a second, because these structural basics are critical. Think of this table as your direct checklist for your architect. Your minimum floor height? That must be 12 feet. Your corridors need to be at least 5 feet wide to allow for easy patient and stretcher movement. Doors have to be a minimum of 3 feet wide. And those patient rooms? They should be at least 10 by 12 feet. Guys, these aren't just polite suggestions. They are the absolute baseline benchmarks for a functional medical facility.
Beyond those basic dimensions, your critical clinical spaces require very specific regulatory and safety norms. For instance, your operation theater must have completely seamless, jointless flooring. You absolutely must install a stretcher-capable lift for vertical movement. No cutting corners there. If you're setting up radiology, it has to strictly meet BABA Atomic Research Center, or BARC, norms. And crucially, as a non-negotiable safety requirement, your bulk oxygen storage must remain outside the main hospital building. And finally, we arrive at Section 6, slashing your electricity costs, managing recurring headaches. Anyone who has ever run a hospital knows that power bills are a massive overhead. But hey, there are very specific ways to drastically reduce them. The first strategy is passive cooling. Basically, this means cutting the building's heat load before it even gets inside. You should apply sun film to window glass and use thick curtains. Up on the roof, applying a Koba heat-reflective treatment on the terrace is incredibly valuable, a real game changer. Paint the building's exterior in light colors, and structurally speaking, try to avoid those oversized glass windows. Specifically, you want to minimize window area on the south and west faces because they take the absolute most heat during the day. Next up, you optimize your equipment load with some highly actionable tweaks. Wherever it's clinically appropriate, use air coolers instead of air conditioners. Actually, doing this can drop your power consumption roughly tenfold. Where an AC is absolutely necessary, run it at 24 degrees Celsius and pair it with energy-efficient BLDC ceiling fans. Swap over to submersible pumps instead of conventional ones, and definitely install dimmers to moderate the exhaust fan speeds in your coolers. Little things, but they add up.
And lastly, you should seriously consider solar power generation. While passive cooling and efficient equipment are absolutely great, installing solar panels is the ultimate forward-thinking solution for permanently slashing your electricity costs over the long haul. It literally transforms a recurring liability into a genuine asset for your practice.
Well, we've covered a tremendous amount of ground today, haven't we? From the exact wording your receptionist should use on the phone, all the way to the heat-reflective paint on your hospital roof. But, it all comes back to this one central idea. Setting up and scaling your clinic isn't just a business transaction. It's a profound responsibility. So what kind of legacy will your medical practice leave behind? Will it be one built on just brisk efficiency? Or will it be one rooted in profound empathy, ethical growth, and incredibly smart infrastructure? The blueprint is firmly in your hands. Thank you so much for joining me today, and I'll catch you in the next explainer.